State Senator Greg Tarver is here for a while. Mr. Greg, how are you this morning? Thank you for taking time for us.
Doing wonderful. How are you doing?
Well, we had State Attorney General Jeff Landry on not too long ago, and as you know, the State Attorney General has sort of inserted or attempted to insert his office into the Biomedical Research Foundation Willis Knighton antitrust lawsuit. He said he's doing it to protect the med school. What do you think about all that?
Well, I don't know the reason why he's involved in it, but he said publicly that he's trying to protect the med school. And I can tell you right now, the med school do need protecting because they're basically not getting the money that they should be receiving from BRF.
So much has now been released, some of the documents with regard to that antitrust lawsuit. I know you've probably sifted through some of it.
No, I haven't.
It's a lot of stuff, though.
I have better things to do.
What most concerns you? You sent out an email yesterday, and you still have a lot of concerns about BRF.
I have concerns about BRF because BRF is not being totally factual with the general public. When they said that they gave LSU $30 million, that is totally not factual. What they did, they gave LSU Baton Rouge $15.5 million. That is for lease payment and for equipment at the hospital. The buildings that is owned by LSU, they're paying for that. They only paid LSU Med School for approximately $14.2 million, a little bit more. That is what they're telling the general public, and they're trying to make the general public think they paid LSU $30 million. That's not true.
Mr. Greg, sounds to me like this lawsuit, the document dump, all the behind the look behind the curtain of the suit. It sounds to me like none of this has an iota of an effect, a whit of an effect on changing your opinion. You think it still is all on BRF's back?
Well, let me tell you this: when you don't pay, give you an example. Don't pay your house note, they will evict you. BRF have not paid their bills in 3 or 4 months. They was not evicted. They owe the state money, and they make them people believe the only money that they're getting is from the state. That's not true. They get private pay money, and they get Medicare money. That is approximately $400 million a year, and they're still not paying LSU Medical School. They owe LSU Medical School right now approximately $15 million.
So when defenders of BRF and defenders of the current system with BRF say, but they're getting markedly less money than the New Orleans school. They're not getting the money. They're making, what is it, like 3 cents on the dime or 3.5 cents on the dime compared to the New Orleans school. You disagree with that reasoning, with that logic, with that defense?
Please don't fall for that rope-a-dope. That's not factual. They included Monroe in their figures, but they don't want New Orleans, UMC in New Orleans, to pick up Toro and Jefferson. They have 3 campuses or 4 campuses in New Orleans. We have 2 in Louisiana, in North Louisiana. We have Shreveport and Monroe. They don't want to count Shreveport. They count Shreveport and Monroe in their figures, but they don't want New Orleans to count their partners in their figures. And so it distort the figures. Now, you know and I know it's more people being served in the New Orleans area than being served in the Shreveport area.
Let me ask you this. Some of the documents have some strong words against Willis Knighton, saying that Willis Knighton has been trying to interfere, and one is to harm the partnerships for BRF with Ochsner and Christus Health. Another says the governor may be involved in trying to, quote, accelerate the demise of BRF. Is this coming from the governor? Do you feel like the governor wants BRF out as well?
Well, let me say this to you. I know the governor have said that he wanted Ochsner in and BRF out because they're not doing a job. But, you know, he has relationships over BRF. I don't really know. I think the best thing to do is to let LSU, and you can stop all this argument, and let LSU Medical School take over the hospital again, and you won't have these problems. I don't know anything about the lawsuit. I'm not a lawyer. I'm an undertaker. But I can tell you that BRF is not paying the debt to LSU Med School.
Mr. Greg, this all goes back, and we've talked about this before, this all goes back to the privatization plan of the charity hospital system in the state by Governor Jindal. There are those that say it was a horrible idea, but there are those who say it's not a bad plan, just poorly implemented. If you could push the button, if it were King Greg of the hospital system, what do you think would work best? What suggestions would you make to solve this whole monetary crisis?
I will bring the hospital back to LSU Med School. That's number one. Then the problem up here would be solved like it was at first. LSU Med School at first made money and was sending money to the state. All of a sudden, they're losing money, and they're depending on the state. If you put these entities back together, you will not have any more problems. You will not have any arguments, anything like that.
Mr. Greg, there are folks around here, and I guess elsewhere, who would say that Dr. Ghali, chancellor at the med school, they've come out and say it on our radio station, that he is a tool, a tentacle of Willis Knighton. What do you think about that?
Let me say this to you. The man is doing the best job he can do. He's working hard. He's trying to put the necessary changes and update the LSU Med School. He's doing a very, very good job. And if he wasn't doing a good job, I would be after him. He's doing a super job at LSU Med School.
So once again, King Greg would say, let's keep Dr. Ghali. I like what he's done.
Yes.
Greg, we're talking to Greg Tarver, state senator. I have a close friend, actually two people, who've spent some time at University Health over the past couple of weeks, and it's been a nightmare in both cases. Is the quality of service hurting now as a result of this management agreement?
Well, let me say this to you. CMS rated them as a 1-star, okay? Mm-hmm. Everybody rated them F. The people who look at the hospital and rate the hospital are the better people to make the decision what type of service that they have, because they go into the hospital to define each area. I'm here to tell you, I go to University Health myself. It is a mess. You take longer to be served, and you're not getting the best care because they don't have the supplies necessary.
So as long as this lawsuit, as long as it drags out, you think that the longer it goes on, the more the med school, the more the hospital will be damaged?
The med school will be damaged completely because they're in their reserve right now. Once you drop below $50 million, the critic agencies start looking at you, and they're getting ready to drop below $50 million. We need to do something to stabilize this, and the only way that you really can stabilize this is take LSU Med School, give them the hospital back. If you put it in a nonprofit and let LSU Med School run it, it would be better for North Louisiana, and we will not be having these conversations anymore.